Your bladder will calm down, stop waking up to pee at night, if you do this. Many individuals regularly wake up to use the bathroom multiple times each night. What often goes unsaid in medical consultations is that in a significant number of these cases, the bladder is perfectly healthy. It isn't the problem itself. The various pills, supplements, and herbal remedies sometimes taken for prostate or bladder issues may, in fact, be targeting the incorrect organ entirely. Consider a common scenario. It's 3 hours in the morning and everything is still. You finally sunk into that deep restorative sleep. Then a signal arrives. Faint at first, at the edge of your awareness, you try to ignore it, to roll over and think of something else. But the pressure steadily builds. You eventually push back the covers, drop your feet onto the cold floor and shuffle to the bathroom, half asleep. You squint against the light, relieve yourself and return to bed, but sleep has vanished. Your mind races with thoughts of work, finances, and family. You lie awake for an hour, finally drifting off, only for the cycle to repeat. A second trip, and you wake in the morning feeling shattered and heavy-headed, needing coffee all day just to function. This experience is frequently dismissed as a normal part of aging. Many believe that getting up at night to urinate is simply inevitable as one gets older. However, this is a dangerous misconception that needs to be clarified. Waking up at night to urinate is not normal, whether you are 40, 50, or 70 years old. A healthy body is designed to function differently during sleep. At night, the brain produces a specific hormone known as antidiuretic hormone, or vasopressin. This hormone acts like a manager sending instructions to the kidneys. Night shift. Stop. Concentrate the urine, reduce its volume, and operate in economy mode. This precise mechanism is what allows a healthy person to sleep for 7 or 8 hours straight without any interruptions. When this essential mechanism breaks down, it is far more than a minor inconvenience. In medicine, the condition of repeatedly urinating during the night is called nocturia. It is a recognized diagnosis. If you find yourself waking up once a night, consider it a warning signal. If you wake 2 or more times, it should be seen as an alarm going off, indicating a more significant underlying issue that needs attention. Every time you wake up, your pulse rate increases, your blood pressure spikes, and you interrupt the crucial phase of deep sleep. This deep sleep phase is when your brain clears out metabolic waste products, neurons repair themselves, and your heart genuinely rests. Years of consistently losing this vital sleep phase can lead directly to health problems such as hypertension, depression, and accelerated brain aging. Clinical research even indicates that nocturia places greater stress on the cardiovascular system than smoking. This is not an exaggeration. It is supported by data from published clinical studies. When individuals present with this complaint, they often already have their own ideas about the cause. Men frequently attribute it to prostate issues, while women might suspect menopause, prolapse, or chronic bladder infections. They may have tried various remedies, such as diuretic herbal teas, antibiotics, or commercially advertised urological supplements. Some even drastically restrict their water intake, going to bed feeling parched, only to still wake up at 3 a.m. in the morning needing to urinate. This happens because they are inadvertently fighting the symptom rather than addressing the root cause. Think of it like a fire alarm going off in the middle of the night. Covering the sensor with tape to silence the noise doesn't solve the problem. The correct response is to find the source of the fire. Similarly, many people treat their nighttime bathroom trips by focusing on the bladder, which acts like a sensor. The bladder is simply signaling that something else is happening elsewhere in the body. In 80% of cases, the bladder is perfectly healthy. It's just doing its job by emptying what is put into it. The issue isn't the reservoir itself, but what is filling it during the night and why. The answer to this question often lies with the legs and the heart. It is crucial to be aware of certain symptoms that warrant immediate medical attention rather than self-diagnosis. First, observe for blood in your urine without pain. If pain accompanies blood, it might indicate a kidney stone or an acute bladder infection which, though miserable, are typically not immediately life-threatening. However, if you see dark red or brown urine or blood clots in the toilet bowl and experience no pain, this is one of the most serious early signs of bladder cancer. For both men and women over 50, this finding directly indicates the need for a cystoscopy, a procedure where a doctor examines the bladder internally with a small camera. Do not delay seeking help for this. Second, be mindful of bone pain combined with sudden weight loss. If your nighttime trips to the bathroom are accompanied by persistent aching in your pelvis or lower back, and you have lost 10 to 20 pounds over 2 months without intentionally dieting, this pattern is a serious warning sign that requires prompt medical evaluation. If neither of these severe symptoms applies to you, you can take comfort in knowing that your situation is likely not immediately life-threatening. However, the quality of your life is worth protecting, and to do so, it is important to understand the specific malfunction occurring within your system. Nighttime urinary problems are generally divided into 3 fundamentally different types in urology, and the treatment for each is distinct. What helps one type can actively worsen another. Type 1 is global polyuria, which means producing too much urine overall. In this type, you urinate frequently both during the day and night, and each time the volume is substantial. If you were to collect all the urine produced in 24 hours, it would typically measure between 3 and 4 liters. There are usually 2 main causes. First, you might simply be consuming an excessive amount of fluids throughout the day, perhaps carrying a water bottle everywhere and believing that more is always better. The basic physics dictates that whatever goes in must eventually come out. The second cause of global polyuria is diabetes, either type 2 diabetes, where high glucose levels pull water with them into the urine, or central diabetes insipidus, a condition involving a hormone disruption in the brain. In this type, the urine is usually pale and almost odorless, and you tend to urinate just as frequently during the day as at night. If this describes your situation, it is important to consult an endocrinologist and undergo a blood sugar test to properly identify and manage the cause. Type 2 is nocturnal polyuria, which is considered the most insidious type and affects 60 to 70% of people over 50. The pattern for this type is quite distinct. During the day, you function completely normally, going about your work, errands, and visiting the bathroom every 4 or 5 hours without pain or burning. However, the moment you lie down for the night, the problem begins with 3 or 4 trips to the bathroom, each time with a full bladder and a large volume of urine. In the morning, it can be perplexing to realize how much fluid was eliminated, especially if you had minimal drinks the previous evening. This is classic nocturnal polyuria, where your kidneys essentially switch their filtration activity to nighttime hours, running at half capacity during the day and at 200% at night. The crucial point here is that if this is your type of problem, your bladder has nothing to do with it, and any treatment aimed solely at the bladder will be ineffective. Type 3 describes a reservoir problem, which is the opposite scenario. Here, the urges to urinate are frequent, sudden, and urgent, making you feel like you won't make it to the bathroom in time. Yet, when you rush there, almost nothing comes out, just a few drops. 40 minutes later, the same intense urge returns, again with minimal output. In this case, the problem lies with the bladder itself. It may have lost its ability to stretch to a normal capacity, or its nerve signals have become hypersensitive, triggering an urge at as little as 50 milliliters of urine, even though the normal capacity before urgency should be 200 to 300 milliliters. This type of problem can occur with benign prostatic enlargement in men, an overactive bladder in women, chronic bladder infections, or bladder and ureteral stones. To recap, if you experience frequent and large volume urination both day and night, it is global polyuria. If you are fine during the day but experience significant urination at night, it is nocturnal polyuria. If you have urgent and frequent urges, but only tiny output, it indicates a reservoir problem. Identifying your specific type is the first step toward effective management. Consider an individual who experienced increasing nighttime urination over several months, eventually waking 4 or 5 times per night. Initially, they might have self-diagnosed a prostate issue and tried various marketed supplements, suppositories and herbal blends, even restricting fluid intake severely. Despite these efforts, they would still wake up multiple times, releasing large volumes of urine, wondering where all the fluid was coming from when they hadn't drunk anything. Upon professional evaluation, their prostate health might appear normal for their age and their bladder perfectly clean. In such cases, the investigation shifts from bladder function to overall lifestyle factors, looking for subtle signs such as shortness of breath when climbing stairs or indentations left by socks on the legs by evening. These seemingly minor details can point to underlying issues like early-stage heart failure, which might otherwise be hidden without dramatic symptoms. During the day, the heart may be working at its limit, unable to fully circulate blood volume, causing fluid to pool in body tissues, especially in the legs. Additionally, sleep disorders like obstructive sleep apnea, characterized by brief, repeated pauses in breathing during sleep, can also disrupt the production of antidiuretic hormone, forcing the kidneys to work more actively at night. Trying to fix nocturnal urination with bladder or prostate supplements when the cause lies elsewhere, such as with cardiovascular health or sleep issues, is akin to trying to fix a leaky faucet while a pipe has burst in the basement. To understand the underlying physics of why this happens to many, visualize a plastic bottle half filled with water. When it stands upright, the water settles at the bottom. When you lay it on its side, the water distributes evenly. Your body functions similarly. For 16 hours a day, you are vertical, standing, sitting. Gravity naturally pulls everything downward, blood, lymphatic fluid, and the fluid between your cells, all towards your feet and ankles. When we are younger, our blood vessels are elastic tubes, and the valves inside our veins effectively hold blood, preventing it from pooling below. The muscles in our legs, especially when we walk, contract rhythmically, acting as a pump to push blood upward against gravity. However, with age or a sedentary lifestyle, this efficient mechanism can weaken. Veins may expand, valves can become leaky, and the muscle pump becomes less active due to prolonged sitting. This allows fluid to seep out through the vessel walls into the surrounding soft tissues. In the loose connective tissue of the legs, up to 1.5 liters of water can accumulate subtly, often without obvious swelling. This amount is equivalent to 3 large mugs of tea, and you might only notice a slight groove from your socks. Critically, your kidneys do not see this pooled water because it has moved out of the bloodstream. The kidneys can only filter what is actively circulating in the blood. As evening approaches, and after a day of being upright, an individual might have a large dinner, perhaps with salty foods, and then sit in front of the television for several hours. During this time, with the legs hanging down, gravity continues to pull fluid, leading to more accumulation in the calves. The heart might also be working slower due to inactivity. Then, when the person lies down to sleep, a critical shift occurs. As the legs rise to the same level as the kidneys and heart, gravity no longer holds the fluid down. All the fluid that accumulated over 12 hours in the tissues of the lower legs rapidly begins returning to the bloodstream. It is reabsorbed into the veins and rushes in a powerful wave toward the center of the body. This causes a sharp increase in the volume of circulating blood. It is as if an extra liter of fluid has been injected directly into the circulatory system within a single hour. This is precisely what happens when there is hidden edema in the legs. At this moment, the heart plays a central role. Specifically, a small but powerful hormone called atrial natriuretic peptide, ANP, becomes active. When the returning fluid from the legs reaches the heart, the right atrium fills and stretches beyond its normal volume. The heart detects this overload and rising pressure, so it releases ANP into the bloodstream, sending a chemical message to the kidneys. The message is simple: dump the excess fluid immediately to prevent overload. This hormone blocks aldosterone, which is responsible for retaining water in the body. Consequently, the kidneys shift into emergency mode, filtering blood at an accelerated rate and expelling water and sodium to protect the heart from being overwhelmed. The result is predictable. Within an hour of lying down, the bladder is full, prompting a trip to the bathroom. However, the fluid from the legs hasn't finished mobilizing. The process continues. 2 hours later, the bladder fills again, and this cycle repeats until morning. This explains why someone who hasn't drunk a drop of water since early evening might still be rushing to the bathroom all night. They are quite literally drinking through their legs. The legs stored significant fluid during the day, which then funnels through the kidneys at night. No prostate supplement or herbal blend can stop this, as those interventions target the wrong organ. Treating the bladder with pills when the cause lies in the heart, and gravity is like taping over a fire alarm sensor while the fire still burns. To determine if this phenomenon is affecting you, simple self-tests can be performed without complex medical procedures. Test 1. Locating hidden fluid. Sit comfortably and expose the lower part of your leg, between your knee and ankle. Find your shin bone, the hard surface along the front of your lower leg that has no muscle covering it. Place the pad of your thumb firmly against this bone about 4 to 6 inches above your ankle and hold it for 10 to 15 seconds. The pressure should be firm and definite. Remove your thumb and gently run the pad of another finger across the same spot. If the skin immediately springs back smooth and flat, there is no significant edema. However, if your thumb left a pit or a dent that does not fill back in for several seconds, a visible and palpable indentation, you have likely located a hidden reservoir of fluid. Even if your leg does not appear visibly swollen from the outside, that pit indicates that your tissues are saturated with water, which will eventually move through your kidneys at night. Test 2. A simplified urine diary. On a day off, take some simple measurements. Get a container with volume markings, such as a measuring cup. Record your urine output separately for daytime and nighttime, including the very first urination immediately after waking in the morning. Add these numbers. If your nighttime urine output exceeds 33%, more than 1/3, of your total daily output, this is officially classified as nocturnal polyuria. For example, if you produce 1/500 ml over 24 hours and 500 ml or more of that occurs at night, this is your situation. Your kidneys have inverted their schedule due to edema or a hormonal disruption, not because of your bladder or prostate, but because fluid is incorrectly redistributing through your body. If both tests yield positive results, a pit remains on your leg, and you produce large amounts of pale dilute urine at night, you can be assured that your bladder is most likely completely fine. You likely do not need surgery, expensive procedures, or lifelong medication. Instead, you need to focus on improving your circulation and adjusting your daily routine. This leads directly to the next steps for improvement. It is also important to consider how food can significantly affect this process. Certain foods can act like a delayed switch on your kidneys, programming them to do most of their work at night. Many people consume these foods at dinner, genuinely believing they are harmless or even healthy. Often, dinner choices might include sandwiches with cheese and cured sausage, or crackers and cream cheese before bed. The culprit here is often hidden salt. While we typically associate salt with what comes from a shaker, 80% of the salt consumed by most people comes from processed and packaged foods such as cheese, cured meats, sausages, mayonnaise, canned goods, and bread. For instance, 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips. This saltiness isn't always sharp on the tongue, often masked by fat and flavor compounds, but it is present. Here is how hidden salt works against you overnight. If you eat a cheese sandwich in the evening, the sodium enters your bloodstream. Your body immediately activates its defense, sensing too much salt and initiating a process to dilute it by holding on to every available molecule of water. This is the effect of osmotic pressure. So in the evening, you won't feel the urge to urinate. The salt keeps water locked inside your blood vessels and tissues. However, overnight, your kidneys detect this accumulated sodium and begin actively excreting it. Sodium acts like a magnet, pulling water along with it. To flush out just 1 gram of excess sodium, the kidneys must process a significant volume of fluid. The result? You wake up in the middle of the night, not because you drank too much, but because you are eliminating the salt from last night's meal. The second factor to watch out for is evening sugar. A cup of tea with cookies or a small apple before bed might seem innocuous, even healthy. However, simple carbohydrates consumed in the evening cause a rapid spike in blood glucose. Your pancreas responds by releasing a burst of insulin. Beyond its primary role in managing blood sugar, insulin also signals your kidneys to retain sodium and water. This initial retention is followed about 2 to 3 hours later, often after you have fallen asleep, by a sharp drop in blood sugar. What follows is a rebound effect, where your kidneys switch to active fluid excretion. Furthermore, if you have any degree of insulin resistance, a condition affecting a substantial portion of people over 40, often without obvious symptoms, elevated blood sugar acts as an osmotic diuretic. Sugar itself pulls water out of your cells and into the urine, essentially providing the biological equivalent of a water pill just from eating fruit or a sugary snack before bed. The third false friend is alcohol. Many find that a small glass of brandy or beer before bed helps them fall asleep faster, acting as a sedative that slows down the central nervous system. However, this is a widespread self-deception, as alcohol is simultaneously one of the most powerful blockers of antidiuretic hormone, vasopressin, the hormone responsible for signaling the kidneys to slow down and concentrate urine. Alcohol cancels this signal entirely, preventing the brain from sending the necessary order. Your kidneys continue to run at full filtration speed without restriction, while the sedative effect of alcohol might allow you to sleep through the first urge to urinate. The bladder continues to fill until the second urge becomes painful and impossible to ignore. Moreover, your overall sleep quality throughout the night will be profoundly poor, lacking deep, restorative, slow-wave sleep. You ultimately wake up feeling completely exhausted and with an urgently full bladder, a worse outcome than if you had abstained from alcohol. Now let's explore what truly helps, the foods that can protect and calm the bladder. First, consider raw pumpkin seeds. It is important to be precise. Not roasted, not salted, and not sugar-coated, but raw, green pumpkin seeds. These are one of the most genuinely underrated urological tools in everyday nutrition. Pumpkin seeds contain zinc and magnesium in highly bioavailable forms, meaning your body absorbs them efficiently. Magnesium relaxes smooth muscle, including the detrusor muscle in the bladder wall, allowing it to expand to a larger volume before triggering the urge to void. The seeds also contain phytosterols, plant-based compounds that strengthen the pelvic floor, supporting prostate tissue in men and pelvic organ support in women. A handful, approximately 30 grams, of raw pumpkin seeds daily is one of the cheapest and most effective bladder health habits you can adopt. Second, cranberries can be highly beneficial. However, avoid bottled cranberry juice cocktails from the store, as these typically contain more sugar than soda, and sugar is counterproductive. What is needed is the actual berry, either frozen or fresh, or a standardized cranberry extract from a pharmacy. Cranberries contain compounds called proanthocyanidins, molecules that prevent bacteria from adhering to the inner lining of the bladder. Even without an acute infection, many adults over 40 may harbor a low-grade bacterial presence in the bladder that chronically irritates nerve endings, making the bladder hypersensitive. A small amount of urine can then trigger an urgent "empty me now" signal. Cranberry helps reduce this chronic irritation and calms the bladder lining. Try adding a handful of cranberries to oatmeal or unsweetened tea. Third, ensure you consume adequate dietary fiber. The connection here is purely mechanical and straightforward. Chronic constipation results in a chronically bloated, gas-filled colon pressing directly against your bladder. Both organs share the same limited pelvic space. An overloaded colon acts like an aggressive neighbor, constantly pushing and compressing the bladder. This external pressure causes the bladder to signal fullness even when it is barely a quarter full. Vegetables like cabbage, greens, zucchini, and bran help regulate bowel function. Maintaining an empty colon at bedtime provides your bladder with the necessary room to expand properly while you sleep, allowing it to fill to a reasonable volume before needing attention and preventing premature urges. To summarize practical nutrition, eliminate hidden salt in the evening by removing cheese, cured meats, and condiments from dinner. Eliminate evening sugar, meaning no fruit, baked goods, or sweetened drinks after 6 p.m. Avoid alcoholic nightcaps such as beer or spirits. Instead, incorporate a handful of raw pumpkin seeds during the day and a small portion of unsweetened cranberry. Adopting these dietary changes alone can often lead to a significant reduction in nighttime bathroom trips. While food forms the foundation and changes biochemistry, if your venous valves are compromised and your vessels have lost their elasticity, nutrition alone may not fully override the physics of fluid distribution. In such cases, more targeted interventions are needed. A simple 3-part daily protocol, involving just about 5 minutes total each day, can be highly effective. This routine addresses fluid dynamics throughout the day and evening. Part 1. Morning. Starting the pump. This begins the moment you wake up. Instead of heading straight for coffee, pause for 30 seconds. After a night of rest, your lymphatic fluid can thicken and pool. It needs to be moved from the very start of the day so that by evening, your legs are primed and less prone to fluid accumulation. Perform a simple vibrational exercise. Stand upright with your feet shoulder width apart. Rise up onto your toes by just 1 to 2 centimeters. Then let your heels drop back down to the floor with a light, firm impact. You should feel a mild vibration traveling from your calves up through your thighs and into your abdomen. Repeat this 30 times at roughly 1 drop per second, taking approximately 30 seconds of your morning. Physiologically, this works by shaking the small valves inside your veins, which prevent blood from flowing backward and pooling downward. With age and inactivity, these valves can become sluggish. This rhythmic vibration helps reactivate them, encouraging blood to move upward against gravity. It is an excellent prevention strategy for evening leg swelling. If standing is difficult due to knee pain or back problems, there is a floor version. Without getting out of bed, raise both your arms and legs straight up and shake them with small, rapid movements, like a beetle on its back. While it may look unusual, it activates lymphatic drainage within 60 seconds and produces real clinical benefits. Part 2. Daytime. The waterfall method. This involves one firm rule for fluid intake. Most people tend to drink less in the morning and significantly more in the evening. This pattern needs to be shifted. Aim to consume 70% of your total daily fluid intake before 4 p.m. Start with a glass of water immediately after waking, carry a water bottle at your desk during work, and include tea and soup at lunch. After 4 p.m., reduce fluid intake, but do not stop entirely, as thirst can thicken the blood and increase clotting risk. After 4 p.m., only take small sips as needed to relieve dryness. As a practical sodium control step, remove the salt shaker from your table entirely and only salt food in the pot during cooking. This single action can reduce daily sodium consumption by 20 to 30% without changing what you eat. Part 3. Evening. The critical move. Approximately 1 to 1.5 hours before bed, while you are watching TV, reading, or simply relaxing, perform the lazy elevation exercise. Lie down on a sofa or the floor and place your legs up on an armrest, the back of a chair, or against a wall. The only requirement is that your heels must be higher than the level of your heart. An angle of about 45 degrees works well, no need to go perfectly. Vertical and strain your neck. Stay in this comfortable, supported position for 15 to 20 minutes. You can read, use your phone, or listen to a podcast during this time. During these 20 minutes, the physics previously discussed now works in your favor. Gravity actively pushes fluid from the spongy tissue of your lower legs back into the bloodstream, which then flows toward the kidneys. your heart receives the signal of increased blood volume and releases ANP. Your kidneys then shift into active filtration mode, causing your bladder to fill. However, you are awake and in control during your evening, fully alert. 30 to 40 minutes after completing the exercise, you will feel the need to urinate. You will go and release approximately 300 to 400 milliliters of urine, the exact volume that would otherwise have woken you at 3 hours in the morning. The principle is simple. You are deliberately wringing out your legs before you sleep, giving your kidneys their workload in the evening while you are awake so they can rest at night. If you have pronounced visible swelling in your legs, consider adding graduated compression stockings. Do not sleep in them, but put on first-grade compression knee-highs when you get home from work in the evening and wear them until your shower before bed. They effectively prevent fluid from pooling in the lower leg tissue during the evening hours. One final essential piece for bladder control is strengthening the pelvic floor. When you are already in bed, lights out and eyes closed, perform 20 to 30 repetitions of Kegel exercises. Many people perform these incorrectly, squeezing their buttocks, tightening their abdomen, or clenching their thighs, which accomplishes nothing. To do it correctly, focus on feeling as if you are trying to prevent passing gas. Or imagine pulling your perineum, the region between your legs, upward like an elevator rising from the ground floor to the fifth. Your abdomen must remain completely soft and your buttocks relaxed. Only the internal pelvic floor muscle group should be working. Contract, hold for 3 seconds, then slowly release. Repeat this 20 to 30 times. This exercise sends a signal through the nerve endings of the pelvic floor directly to your brain. When these muscles are toned and the internal valve holds firm, the system can rest. The neurogenic overactivity of the bladder, where it fires an alarm at every small sensation, decreases. The bladder stops panicking at minimal urine volumes and begins operating in a normal, calibrated mode. This completes the protocol. This method works reliably because it is built on physiology, physics, biochemistry, and neuroscience, rather than wishful thinking. It requires one crucial element: consistency. This is not a pill you swallow and forget. You perform these steps every day, and that consistent effort is precisely what makes it genuinely powerful. Your age plays a significant role here. The fluid redistribution mechanism described becomes progressively more pronounced as the venous system ages. The competence of venous valves decreases, the elasticity of vascular walls diminishes, and cardiac reserve narrows. Research consistently shows that in people over 50, nocturnal polyuria driven by peripheral fluid mobilization occurs approximately 3 times more often than in those under 40. Here is a concrete 5-step plan for tonight. 1. Do the thumb test on your shin bone right now. Press firmly and check if a pit remains after you remove your thumb. 2. On your next day off, measure your total urine output and calculate what fraction occurred at night. 3. Remove the salt shaker from your table tonight. Replace your dinner of processed meat and cheese with something free of hidden sodium. 4. Approximately 1 hour before bed, lie down and put your legs up on the back of your couch or against a wall for 15 minutes. 5. Before sleep, do 20 to 30 correct Kegel repetitions, ensuring only your pelvic floor moves and everything else remains relaxed. If the pit in your legs stayed after the test, if you notice shortness of breath climbing a flight of stairs, or if your socks leave grooves in your skin by evening, it is advisable to consult a cardiologist and a vascular specialist first, rather than a urologist. This is often the critical path to understanding the underlying issues. Your body is not broken, and your bladder is not your enemy. It is a signal light. Now you understand how to address the cause and turn off that signal, rather than merely ignoring it. The protocol described requires no prescription, no expensive procedures, and no money beyond possibly a pair of compression stockings. It merely requires an understanding of how your body truly works and the discipline to apply that knowledge consistently. This type of detailed explanation of fluid mechanics and pelvic floor neurology is often overlooked in brief office visits.